When weak legs are more than just aging, it doesn't happen all at once. You don't wake up one morning unable to stand or walk with ease. Instead, it begins quietly. Maybe you notice a little more strain when getting up from your favorite chair. Or perhaps the stairs you've climbed for decades now make your legs tremble. You pause longer at the top. You hesitate more often before standing. You begin to fear the floor. If you're over 60 and you've noticed any of this, let me assure you, you're not imagining things. But here's what you need to know. Weak legs are not a normal part of aging. They are a warning sign. As a physician specializing in geriatric health, I've heard countless older adults dismiss their declining leg strength as just getting older. But the truth is, leg weakness is often a sign that something deeper is happening. Something that, if left unchecked, can lead to falls, fractures, hospitalizations, and a serious loss of independence. But here's the good news. You can do something about it, and you don't need to become a fitness guru to see results. Whether the cause is muscle loss, poor blood flow, nerve damage, spinal compression, or an imbalance in minerals, there are clinically proven, practical ways to reverse these effects, even in your 70s or 80s. In this guide, I'll walk you through the 5 most common medical causes of leg weakness after 60. More importantly, I'll show you what you can do starting today to regain strength, restore mobility, and reclaim confidence in your steps. Let's begin with one of the most silent yet powerful threats to your leg strength: sarcopenia. 1. The hidden enemy: sarcopenia and the shrinking of strength. Among the many changes that happen to the body as we age, one of the most dramatic and dangerous is the loss of muscle mass. This condition, known as sarcopenia, begins subtly in your 30s but accelerates rapidly after age 60. By the time you're in your 80s, you may have lost up to 30 to 40% of your muscle mass if you're not actively maintaining it. Sarcopenia is not just about looking thinner or weaker. It's about losing the physical foundation for your independence. It's the reason why once simple tasks like getting up from the floor, climbing stairs, or walking across the grocery store become harder or even impossible. Why sarcopenia happens? There are several key factors behind this age-related decline in muscle strength. Hormonal shifts. Testosterone and growth hormone levels decrease with age, reducing the body's ability to build or repair muscle. Inactivity, retirement, and joint stiffness often lead to sedentary lifestyles, which cause muscle fibers to shrink. Protein deficiency. Seniors frequently eat less protein than their bodies require for muscle maintenance. Neuromuscular decline. Aging results in fewer motor neurons, which reduces the brain's ability to stimulate and control muscles. What makes sarcopenia especially dangerous is how gradually and silently it progresses. Many seniors don't notice until they start falling more often or until climbing stairs becomes a daunting challenge. But by then, a substantial amount of muscle may already be lost. What I've seen in practice. I once had a patient, Mr. R, a 75-year-old retired teacher, who came to me after slipping in his bathroom. He didn't have any broken bones, but what he did have was clear sarcopenia. His thighs were noticeably smaller than just a year prior. He had stopped gardening and walking, and he admitted to eating mostly toast and coffee for breakfast. His story is far too common. We developed a plan that included light resistance training using resistance bands and chair squats, increasing protein intake to 90 grams per day, spread over 3 meals, a vitamin D supplement, and routine walking. Within 10 weeks, he had gained 2 pounds of lean muscle, improved his balance, and was walking confidently again. How to fight back against muscle loss. Here's what I recommend to my patients and now to you. Eat more protein. Aim for 25 to 30 grams per meal. Eggs, fish, yogurt, chicken, and beans are excellent sources. Start resistance training. No gym required. Use your body weight, resistance bands, or even water bottles. Walk every day. Even 10 to 15 minutes can stimulate muscle maintenance. Don't forget vitamin D. Get tested and supplement if necessary to support muscle and bone health. Rest and recover. Sleep is when your body rebuilds muscle tissue. Aim for 7 to 8 hours each night. Sarcopenia is the hidden enemy of aging. It doesn't cause pain, it doesn't show up on the scale, and it doesn't get much attention until it's already stolen your strength. But once identified, it's also one of the most reversible problems facing seniors. Your legs don't have to grow weaker with age. They can grow stronger if you give them a chance. Let's now look at another major culprit behind leg weakness: the crisis of circulation. 2. Circulation crisis: how blood flow shapes leg power. When it comes to leg strength, most people immediately think of muscles, but few think of blood. And yet, circulation is the lifeline of your legs. Without adequate blood flow, even the strongest muscle fibers are starved of oxygen and nutrients. This is especially critical after the age of 60, when circulatory issues become increasingly common and insidious. One of the most overlooked culprits in leg weakness is peripheral artery disease, PAD. This condition occurs when fatty deposits build up in the arteries, restricting blood flow to the limbs. The arteries leading to your legs become narrowed, reducing the amount of oxygen-rich blood reaching your muscles during activity. The result? Legs that feel tired, weak, cold, or painful even after mild exertion. I've seen patients come in reporting heavy legs or discomfort when walking that mysteriously goes away when they sit down. Many assume it's arthritis or aging. But clinically, this pattern of pain, called intermittent claudication, is a hallmark sign of PAD. The vascular warning signs. Poor circulation in the legs can manifest in several subtle ways. Cramping in the calves while walking. Feet that feel cold to the touch. Numbness, tingling, or a burning sensation in the lower limbs. Slower healing of minor cuts or sores on the feet. Noticeable weakness or fatigue during basic tasks like climbing stairs. Over time, if left unaddressed, PAD can lead to more serious complications: ulcers, infections, and even an increased risk of cardiovascular events like heart attacks and strokes. Why does circulation decline after 60? The aging process naturally causes blood vessels to lose some elasticity, making it harder for them to expand and contract. Adding years of elevated blood pressure, high cholesterol, smoking history, or diabetes, and the damage can accelerate. For seniors, even mild dehydration can thicken the blood and further hinder circulation. This is why seemingly simple habits like drinking water or staying mobile become medically significant in later life. A doctor's perspective: what works? In clinical practice, I advise my patients over 60 to approach circulatory health with the same seriousness as heart health, because the two are intimately linked. Here's what makes a difference. Walking daily. Regular walking, even just 20 minutes, helps stimulate blood vessel growth and maintain arterial flexibility. It also improves the muscle's ability to use the oxygen they receive. Hydration. Seniors often lose their natural thirst cues. I encourage sipping water throughout the day and avoiding dehydration, especially in the morning and during hot weather. Reducing salt intake. Lowering sodium helps prevent fluid retention and leg swelling, both of which impair circulation. Leg elevation. Raising the leg for 10 to 15 minutes at the end of the day helps drain pooled blood and improve venous return. Massage and warm baths. These not only feel good, they also boost circulation to the extremities. Blood work and imaging. For at-risk patients, an ankle brachial index, ABI, test is an easy way to screen for PAD. Cholesterol and blood sugar levels should also be closely monitored. A patient's story: walking to wellness. Mr. T, age 68, came to me with complaints of leg cramping after just 50 steps. He was convinced it was arthritis, but a simple ABI test revealed moderate PAD. We developed a conservative treatment plan focused on walking 15 minutes a day, reducing salt, and adjusting his blood pressure medication. Within 6 weeks, he was walking 25 minutes without discomfort and feeling 10 years younger. His case is one of many that shows how circulation can be improved and quality of life restored with focused, manageable actions. Key takeaway: your legs aren't just powered by muscle, they're fueled by blood. Weak circulation leads to weak performance. But with consistent care and attention, it's possible to nourish your legs from the inside out, no matter your age. Next, we'll explore another major cause of leg weakness that operates in silence: the nerves beneath your skin. 3. Nervous silence, peripheral neuropathy, and balance loss. If your legs feel like they've gone numb, if your feet often tingle or burn, or if walking feels strange, like stepping on a sponge, it may not be your muscles or your blood that's to blame. The issue might be with your nerves. Specifically, you could be experiencing a condition called peripheral neuropathy, one of the most underdiagnosed causes of leg weakness, instability, and falls in adults over 60. What is peripheral neuropathy? Peripheral neuropathy is damage to the peripheral nerves, the ones outside your brain and spinal cord that deliver messages between your central nervous system and your limbs. These nerves are responsible for both sensation, feeling, and motor function, movement. When they become damaged or disrupted, your legs and feet may become numb, hypersensitive, or weak. Nearly 1 in 3 older adults experience some form of peripheral nerve damage, and the symptoms are often mistaken for just aging. But neuropathy is not inevitable. It has causes, and it can be slowed or even improved with the right treatment. Common causes in seniors. The most common causes of neuropathy include type 2 diabetes. High blood sugar levels damage small blood vessels and nerves over time. Vitamin B12 deficiency. This vital nutrient helps protect nerve health. Low levels can lead to tingling, numbness, and muscle weakness. Chronic alcohol use. Alcohol is toxic to nerves when consumed in high or frequent amounts. Medication side effects. Some chemotherapy drugs, antibiotics, or cholesterol medications can damage nerves. Thyroid dysfunction or autoimmune diseases may also play a role. Symptoms to watch for: tingling or numbness in your toes or feet, burning pain or electric sensations in your lower legs, loss of balance or floating feeling when walking, difficulty feeling textures like carpet or smooth floors, muscle weakness, especially in the ankles and toes. The danger of neuropathy lies not just in the discomfort, but in the loss of connection between your brain and your body. When you can't feel the ground beneath your feet, your brain can't accurately control your steps, leading to missteps, stumbles, or serious falls. Clinical perspective: what I recommend. In my practice, I always screen seniors with balance issues for neuropathy. One patient, Ms. E., aged 69, had been falling unexpectedly. She wasn't dizzy, and her strength was decent, but her feet felt like wood. Blood tests revealed B12 deficiency and borderline high blood sugar. We adjusted her diet, added a methylated B12 supplement, and began physical therapy focused on nerve stimulation and gait retraining. Her fall stopped within 2 months. Here's what I suggest to anyone noticing nerve-related leg symptoms. Get tested. Ask for a blood test checking vitamin B12, fasting glucose, and thyroid levels. Improve your nutrition. Eat foods rich in B12 like eggs, dairy, and leafy greens. Control blood sugar. Keep diabetes or prediabetes tightly managed with diet and movement. Avoid alcohol. Minimize or eliminate alcohol, as it worsens nerve degeneration. Exercise for balance. Tai Chi, yoga, and balance drills can re-engage your nervous system. Massage and stimulation. Regularly massage feet and legs to improve blood flow and sensation. Some patients benefit from alpha-lipoic acid supplements or medications prescribed specifically for neuropathic pain, but this depends on severity and diagnosis. What you need to know: your nerves are your internal communication lines. When they're damaged or disconnected, your legs can no longer reliably respond to your intentions. The result is not just weakness, but disorientation, loss of safety, and loss of confidence. The key is to act early. Tingling feet today could mean weakened legs tomorrow, but with attention and care, it doesn't have to be that way. In our next chapter, we explore another common but unexpected culprit: your spine, and how problems there can silently undermine your leg strength. 4. The spine-leg connection. How back problems collapse mobility. It surprises many people to learn that problems in the lower back can cause weakness in the legs. But medically, this connection is clear and often overlooked. When I see a senior with leg issues, One of the first things I assess is the condition of their spine. Your spine is not just a stack of bones. It is the central highway for nerve signals traveling from your brain to your limbs. Any damage, compression, or misalignment in the spine, particularly in the lumbar region, can interfere with these signals. When that happens, muscles in the legs may not fire correctly, resulting in weakness, instability, or even numbness and pain. Common spinal issues that affect leg strength. Herniated discs. These occur when the cushion-like discs between your vertebrae bulge out and press on nearby nerves. This is one of the most common causes of sciatica. Spinal stenosis. This is a narrowing of the spinal canal, which compresses the nerves. It's very common in adults over 60. Degenerative disc disease. The normal wear and tear of the spinal discs over time can result in pain, stiffness, and nerve compression. Poor posture or prolonged sitting. Years of sitting hunched over or with improper support can distort spinal alignment and lead to chronic pressure on nerves. Symptoms that point to a spinal cause. Pain radiating from the lower back into one or both legs. Numbness, tingling, or weakness in specific areas like the thighs or feet. One leg feeling weaker or heavier than the other. Relief when sitting or leaning forward, classic in spinal stenosis. Sudden difficulty rising from a chair or standing upright. One patient of mine, Mr. J, a 74-year-old former mechanic, came in reporting weakness in his left leg. He hadn't injured himself, and he walked daily, but he often had to stop after a block and sit down. His x-rays revealed moderate spinal stenosis compressing nerves near his L4, L5 vertebrae. After starting physical therapy, making postural adjustments, and doing nerve gliding exercises, his symptoms improved significantly in under 8 weeks. Strengthening the spine to support the legs. The good news is that you don't always need surgery to improve spine-related leg issues. Most cases can be managed, or even reversed, through conservative measures. Core strengthening. A strong core supports the lower back and reduces pressure on spinal discs. Exercises like bird dog, pelvic bridges, and modified planks are great for older adults. Posture correction. Use lumbar support when sitting. Avoid slumping, and make sure your ears, shoulders, and hips are aligned when standing. Spinal mobility exercises. Gentle stretches like seated spinal twists, cat-cow, and knee to chest can relieve tension and improve flexibility. Avoid prolonged sitting. Stand and walk every 30 to 45 minutes. Sitting increases pressure on spinal discs. Use proper footwear. Supportive shoes help maintain spinal alignment and reduce nerve compression caused by poor mechanics. If symptoms persist, imaging, MRI, or CT may be necessary. In some cases, corticosteroid injections or targeted procedures can reduce inflammation and nerve impingement. However, most cases of age-related spinal compression respond well to therapy and lifestyle changes. Key takeaway: if your leg weakness is accompanied by back pain, shooting nerve pain, or asymmetrical symptoms, look to your spine. A healthy spine allows nerves to send clear messages to your legs. And when those messages are blocked, strength is lost, not because of your muscles, but because of the disconnection at the source. In the next chapter, we turn our attention to something smaller, but just as critical: the minerals inside your bloodstream that keep your muscles working properly. 5. Mineral mayhem. The electrolyte imbalances that sap your strength. Sometimes the problem with weak legs isn't in your muscles, nerves, or spine. It's in your blood chemistry. Specifically, it can come down to something so subtle that many doctors overlook it: electrolyte imbalance. Electrolytes are minerals in your body, like potassium, magnesium, sodium, and calcium, that carry electrical charges and play critical roles in nerve function, muscle contraction, hydration, and heartbeat regulation. When they are out of balance, your body will tell you, especially through your legs. And yet, countless older adults experience daily weakness, leg cramps, shakiness, or fatigue because their electrolytes are too low, too high, or simply poorly regulated. Why seniors are at higher risk? There are several reasons why electrolyte imbalance is far more common in adults over 60. Dehydration. The thirst mechanism becomes less sensitive with age, making older adults more prone to chronic dehydration. Medications. Diuretics, water pills, blood pressure medications, and laxatives can flush key minerals out of the body. Lower kidney efficiency. As the kidneys age, they may struggle to regulate fluid and mineral levels. Poor diet. Many seniors consume fewer fruits, vegetables, or whole foods, leading to lower intake of vital nutrients. The two most common deficiencies I see that affect leg strength are magnesium and potassium. Potassium, the muscle regulator. Potassium helps transmit nerve signals and contract muscles. Too little can lead to muscle weakness, cramps and spasms, especially at night. Fatigue, irregular heartbeat. Even a mild potassium deficiency can make the legs feel like they give out unexpectedly. Foods rich in potassium include bananas, oranges, avocados, spinach, sweet potatoes, and beans. But here's the catch. For individuals with kidney issues, potassium can become dangerously high. That's why I recommend routine blood tests to find your baseline before supplementing or drastically increasing intake. Magnesium, the silent deficiency. Magnesium plays a critical role in muscle relaxation after contraction, nerve conduction, energy production, ADP synthesis, maintaining steady heart rhythm. A deficiency in magnesium often shows up as twitching or tremors in the legs, difficulty falling or staying asleep, anxiety and restlessness, muscle cramping or stiffness. Unfortunately, over 60% of older adults are magnesium deficient, and it's often missed on standard blood tests. That's because only 1% of magnesium is in your blood. The rest is stored in cells and bones. Sources of magnesium include almonds, pumpkin seeds, dark leafy greens, black beans, and dark chocolate. For supplementation, I usually recommend magnesium glycinate or citrate, which are better absorbed and gentler on the stomach. Recognizing the signs of imbalance. If you experience any of the following, consider having your electrolyte levels checked. Sudden leg cramps, especially at night. Muscle weakness despite exercise and protein. Dizziness or lightheadedness. Heart palpitations or skipped beats. Confusion or brain fog. Fatigue that doesn't improve with rest. One patient of mine, Mrs. S., 70 years old, had been struggling with night cramps and general fatigue. Her lab showed low potassium and borderline magnesium. We adjusted her medications, added a morning smoothie with spinach and almond butter, and supplemented with low-dose magnesium. Within 2 weeks, her cramps were gone, and she had more energy during her walks. Small fixes, big results. Here's what I recommend for optimizing your mineral balance. Stay hydrated. Sip water throughout the day. Don't wait until you feel thirsty. Eat mineral-rich foods daily. Focus on a variety of fruits, vegetables, nuts, and whole grains. Be cautious with salt and processed foods. They can throw off sodium-potassium balance. Limit alcohol and caffeine. Both can dehydrate and interfere with mineral absorption. Check your medications. Talk to your doctor about how your prescriptions might affect electrolyte levels. And if you suffer from frequent leg cramps, try a warm Epsom salt bath before bed. Epsom salts contain magnesium sulfate, which can be absorbed through the skin and help muscles relax naturally. Key takeaway: your legs don't just need movement, they need minerals. And for many older adults, muscle weakness has less to do with exercise and more to do with what's missing inside. With just a few dietary changes and a better understanding of your electrolyte needs, you can make a big impact on your strength, energy, and confidence. Up next, we bring everything together into a clear action plan, based on what I recommend every day to my patients. 6. A unified plan. How to rebuild leg strength and stay independent. Now that we've uncovered the 5 major causes of leg weakness after age 60, sarcopenia, poor circulation, nerve damage, spinal compression, and mineral imbalances, it's time to shift from awareness to action. Whether you're already experiencing symptoms or simply want to prevent them, this chapter outlines a practical, science-based strategy to preserve and rebuild your leg strength, gently, effectively, and consistently. The goal is simple: to stay independent, mobile, and confident in every step you take. Step 1. Move daily, even in small doses. Movement is medicine, especially for aging legs. You don't need a gym or complex equipment. You just need consistency. Try this gentle daily routine. Morning, 5 minutes of gentle stretching, hamstring, calves, hip flexors. Midday, 10 to 15-minute walk around the block or inside the house. Evening, 10 chair squats, heel raises, and seated marches. Add resistance training 2 to 3 times per week using resistance bands, light hand weights, body weight exercises like wall push-ups or step-ups. Rule of thumb: if you can walk to the kitchen, you can train your legs. Don't underestimate short, frequent efforts. Step 2. Fuel muscle function with the right foods. Your muscles and nerves rely on proper nutrition to recover, rebuild, and perform. Daily nutrition guidelines. Protein. Aim for 25 to 30 grams per meal. Eggs, beans, yogurt, fish, chicken. Magnesium. Include pumpkin seeds, almonds, spinach, or magnesium glycinate if needed. Potassium. Eat bananas, oranges, avocado, sweet potatoes. Hydration. 6 to 8 cups of water per day. More if you're active or in warm weather. Limit processed foods and sugars, which inflame tissues and strip mineral balance. Example: a smoothie with spinach, almond butter, banana, and Greek yogurt is a great breakfast for strong legs. Step 3. Monitor and test regularly. Too often, underlying conditions go unnoticed until it's too late. Be proactive with your health monitoring. Ask your doctor about vitamin B12 levels, vitamin D levels, kidney function, especially if on medications, electrolyte panel, potassium, magnesium, sodium, blood sugar, and A1C for diabetes risk. Ankle brachial index, ABI, if you experience leg cramping or heaviness when walking. Early testing leads to early intervention and fewer surprises. Step 4. Support your spine and posture. Protecting your spine is critical to ensuring nerve flow and leg strength. Everyday habits. Sit with lumbar support or a small pillow behind your lower back. Avoid slouching or sitting for more than 45 minutes without standing. Do simple core exercises like pelvic tilts or bridges. Use supportive shoes and avoid flat sandals or worn-out soles. If you have back pain with leg weakness, seek physical therapy before assuming it's just aging. Step 5. Calm inflammation and promote recovery. Chronic inflammation interferes with every system involved in leg function. Combat it with sleep. 7 to 8 hours of uninterrupted sleep promotes recovery and hormonal balance. Anti-inflammatory foods. Turmeric, olive oil, berries, leafy greens, fatty fish. Stress reduction. Meditation, deep breathing, or gentle yoga. Active rest. Balance exercise with moments of relaxation and reflection. Recovery is where the real transformation happens. Don't skip it. Step 6. Track progress and celebrate small wins. Healing and strengthening your legs is a journey. Track progress in a notebook or digital app. Celebrate going farther without stopping. Doing an extra squat or 2. Climbing stairs with less effort. Standing taller and steadier. Even small improvements are major victories because they lead to sustained independence. Final words of guidance. You're not powerless against aging. Your legs may have grown weaker, but they are still alive with potential. Muscle can regrow. Circulation can improve. Nerves can heal. Your spine can become stable. Your minerals can rebalance. Most importantly, your spirit can renew. I've seen countless patients regain strength in their 60s, 70s, even 80s. Not because they ran marathons, but because they walked with purpose, lifted their bodies with intention, and believed they still deserve to move freely. This journey isn't about perfection. It's about showing up. One stretch, one walk, one meal, one breath at a time. Strong legs don't just carry your body. They carry your life. Let's move forward together. Strong legs, strong life. Your path forward begins now. When we talk about growing older, we often talk about loss. We talk about losing speed, strength, flexibility, and freedom. We talk about aches that weren't there before, steps that feel heavier, and routines that become harder. But what we rarely talk about is how much power you still hold, and how much you can regain, especially when it comes to your legs. Because your legs are not just limbs. They are the foundation of your independence. They are how you reach the kitchen to make tea, how you walk with your grandchildren in the park, how you rise from your chair to greet an old friend, how you stand tall, not just physically, but emotionally, mentally, spiritually. If your legs have grown weaker, it's not a personal failure. It's not inevitable. It's not too late. It is a signal, one that your body is asking for your attention, your care, and your commitment. And here's what I want you to remember as a doctor who has walked beside thousands of older adults. Muscle can grow at 70. Balance can improve at 75. Strength can return at 80. Confidence can be rebuilt at any age. Yes, you may need to move slower. Yes, you may have to listen to your body more carefully. But you are still capable of progress. Meaningful, life-changing progress. If you remember nothing else, remember this. Weak legs are not your destiny. Falling is not your fate. Fragility is not your final chapter. You have the tools, the knowledge, and the ability to choose a different path. It begins with the next small action you take. A glass of water, a deep breath, a short walk, a handful of almonds, a new commitment to your body, not to push it, but to support it, to rebuild with compassion and consistency. So rise, if not yet to your feet, then in your mind. Decide that you are worth the effort, that your strength still matters, that your journey isn't over, it's evolving. And as you take those steps forward, know this. You're not walking alone. I'm with you. And so is every older adult who has chosen strength, movement, and dignity over decline. You have strong legs. You have a strong will. And you have a life still waiting to be lived on your own 2 feet. Begin now. One step is all it takes.